Kakati leero tuyitiddeko mu bitege. Ebitege, I think everyone has ever seen ebitegge, or what we call ball legs, or Genu varum in the medical term. So I believe in childhood or in adulthood, everyone has ever come across a baby having such a condition, or most of us at one time we have had this condition that later resolves or persists and becomes worse. So bye ebitegge olwaleero. So what we need to know is that ebitegge, or the ball legs, or Genu varum, is a skeletal deformity which physically manifests with bowing out of your knee joints, especially when someone is bearing weight on those limbs. So at one time it can be physiological or pathological, and it can manifest in both children and adults. So it can be expected at one time, especially in childhood, ng'omwana akula, or it can be pathological, especially ng'omwana ayise mu stages ezo ez'okukula ate n'asigala ng'akyalina ebitege ebyo, oba nga beeyongedde bweyongezi, oba mu bukulu, someone is already an adult but didn't have the ball legs, but all of a sudden they begin to develop. There are very many causes and risk factors which we are going to dive into. So there is a lot of literature surrounding this Genu varum, or these ball legs, ebitegge. And one may need to read quite some of them so that they may conceptualize and come up with a bit of, let's say, concept. But what we need to know is these ball legs can be both physiological and pathological, in the sense that, okay, what I mean, they can be expected at a certain age, especially in childhood. But when that age is gone and this baby or this child still has the ball legs, or they are just increased in their angle, or when this condition just manifests all of a sudden in adulthood, this cannot be attributed to being physiological, but rather pathological. So during childhood, we still have cell division along the ends of our long bones at the physis, so that we may increase in length of the bone, so that the height of the child increases. So there are a lot of theories as to why these ball legs can come in childhood. And that's why those legs go through different shapes up to when your legs become strong to support your trunk. And that's why up to a certain age, Genu varum is okay in children. But after or beyond a certain age, depending, it can be considered pathological, or it may stimulate someone to investigate biochemically or radiologically as to why the knees are having Genu varum. So that's why in childhood we need to usually rule out a couple of things. We need to look at how this baby has been feeding. We need to look out whether this baby had trauma to the knees or not, where the growth plates are located. We need to find out whether this baby doesn't have any mineral deficiencies. We need to make sure that these growth plates are not compressed, or are not at one way or the other, let's say in the sides, where it is not growing to reaching to a certain rate like the other side, it's not compressed in any way. So there are a lot of things to rule out. That's why we usually first observe, and then after all those other features are ruled out, then we go on to investigate invasively and manage. So for so long as a child is still in the age of growing, or still in that active growing stage before the fusion of the fascial plates, we need to find out that, is this growth plate like not inhibited to grow? Isn't it compressed? Wasn't it crushed? Didn't the baby have any trauma to the growth plate before that injured it so that the cells can divide? Does the growth plate have enough minerals which are needed, or the sufficient nutrients? And there are any nutrition deficiencies? That's why observation is quite crucial. Then in adulthood, usually it can either be a progression from the childhood, which our legs didn't correct, and they still manifest in childhood. Let's say they show up at the clinic with them. Then sometimes some pathology, some diseases, like in severe osteoarthritis, you may find that there is a certain degree of narrowing of a joint towards one side. So this knee will not be able to bear weight which the trunk exerts on it. So what happens is it will bend to one side, creating that angulation that can manifest as the what? The Genu varum. Then still there can be mineral deficiencies as well. Sometimes it could be a metabolic or an endocrine disorder. We know that hormones control the values of or the quantities of these minerals which make up the bone. Yeah, and sometimes it can be genetical. So it's quite a couple of things to rule out. So this is the X-ray of both the knees, including both the femur and the tibia and the fibula, as the bones in the legs that make up the knee. So these are some of the investigations which your healthcare provider will ask for you to try to identify any origin of this bowing, in addition to other biochemical tests. Like they can ask you to draw a sample of blood to check for those minerals. So you have to get timely management so that you avoid your knees to be incapable of supporting your weight as you do your daily activities, which can impair your capability as you do your daily duties. Thank you.